We've got one more short discussion to have before we break for lunch and refuel, and it's a really interesting one centred around healthcare and what to expect if you move to the island, what the options are. Absolutely delighted that we have some real insight here today from Owen Cole, who's a consultant urological surgeon who's going to talk to us about his experiences here. So, Owen, please welcome. Come to the stage. Because look, I think, Owen, a lot of people will be thinking, look, if I do make the move to Guernsey, you know, I've got experiences in the UK of, you know, what it's like to try and get a GP appointment, or maybe what the NHS waiting lists are like in the UK at the moment. Can you give us a sense from your experience in Guernsey, what to expect? What's it like for people who might make the move to Guernsey?
Yes, thank you. So there are similarities and differences. The similarities are that all doctors working in Guernsey will be GMC accredited. We have to go through the same appraisal and governance processes. For us specialists, we have to be on the specialist register, so go through exactly the same training as UK-based consultants. And most of us have been consultants in the UK before moving to Guernsey. There are differences though, and we feel that there are advantageous differences. The first is that primary care, so GP care, is privately provided only. And whilst that may seem like a disadvantage, what it does mean is that you can always get an appointment on the same day that you want one, and your continuity of care is very good, so you generally see your own GP. So just as a sort of an example, my daughter woke up very ill at 5 o'clock on Monday morning, saw a GP at 8 o'clock, and was back at school at 9:30 having been treated. I think in other places she might wait 2 or 3 days and be off school for 2 or 3 days. So primary care, you do really see, as both a patient and a doctor, the advantages of private primary care and being able to access the GP of your choice whenever you want to. Secondary care is slightly different in the fact that it's free at the point of delivery, but actually it's provided by a partnership, of which I'm a partner, which is contracted to the states of Guernsey to provide secondary health care, or so hospital care, free at the point of delivery. So we're not actually employed by the states, but we're a business essentially. The main difference in that is that it's consultant delivered, so we don't have any junior doctors at all. And whilst as a consultant, I miss training junior doctors, actually not having them around makes life much, much easier in the fact that far more efficient. You've got senior decision makers, not just in your own specialty, but in all specialties. And it makes medicine much more efficient. And actually, we do find that, again, patients will always see a consultant, generally a consultant of their choice, and have continuity of care. There is a private offering as well with secondary care, and about 30% of the population will have private insurance. And there's slightly different offerings we can offer there. But generally, all secondary healthcare is free at the point of delivery, and it's consultant delivered.
Significant number have private healthcare. That's interesting. And I just think, to clarify, so basically, if people book a GP appointment, you say that's sort of private effectively, people would pay to have a GP appointment. Is that right?
Yeah, so the GP...
Can you give us a sense of how much that is and why you think that's actually can be a good thing?
So the GP appointment costs £69. Again, more people will have insurance covering primary care than secondary care. And there's local insurance companies as well as the sort of national insurance companies that cover that. For lower earners, there is government subsidies. We don't, certainly in secondary care, see any population health disadvantage in having private primary care, in the fact that we don't really see people delaying presentations. And in fact, we do see health advantages in secondary care because of the continuity of care that patients have. And as hospital doctors, we're getting appropriate referrals in patients who've been really well treated beforehand.
So people pay to go to a GP, and is a sense of why that might be an advantage is maybe in the nice possible way you don't get people just thinking, I've got a bit of a tickly throat, I'm going to go to the GP for this, because you think if you've got to pay £70, they're not going to do it. Whereas if you've got people who, like you mentioned with your daughter, think I'm actually really not well, I'm happy to pay the money because I'm going to get that instant appointment, that instant care.
Yeah, I think the instant care is really important, but more importantly is the continuity of care that GPs are able to offer. My parents live in North Devon, which you'd think would be a good place for a GP to be, but they haven't seen a substantive GP for 3 years. They've been locum GPs. And the continuity
so seeing lots of different people.
Yeah, so the continuity of care is so important, particularly in primary care, because it staves off serious illnesses. People have a relationship with their doctor that they can access quickly. And actually, it takes the pressure off hospital care then, because we're not seeing inappropriate stuff coming through that hasn't been dealt with properly in primary care.
You've worked in the UK as well, haven't you? So I think it's really important to stress that you have this distinctive perspective, that you know what it's like in the ground in the UK when it comes to GPs, when it comes to the NHS and so on, but you know what it's like in Guernsey as well. How would you sum up maybe one or two of the absolutely key differences? I know you've spoken about primary care, etc., but how would you maybe sum up Guernsey as a a better option, if you like?
Okay, well, I will say I'm still a great defender of the NHS, and I loved working in the NHS. And actually, I still feel a bit guilty leaving the NHS. But actually, it was a real production line there, and we were governed by targets, governed by getting as many patients through as possible, and not really treating patients as patients and people. And that's completely different in Guernsey, where I'm the only urologist, so I see I know a lot of my patients. We talked about going around Waitrose a bit earlier. It takes me about 2 hours to go around Waitrose because we'll see patients. Slight disadvantage.
So sometimes you might go in with a cap and some dark glasses on to get around the bread and the milk aisle.
But it's mainly the personal touch, basically. And actually, the personal touch makes healthcare better. If you know the person well that's sat in front of you, you can treat them far better.
That extra detail, that extra insight you think is important, rather than maybe someone you've not seen before leafing through your notes for possibly the first time.
And also, so we know that they're getting really good care from their GPs, but also if I need to refer to colleagues, it's always to a consultant and we get a quick senior decision. And again, that makes care much better and that much more efficient.
We hear a lot in the UK about possibly NHS waiting lists, pressures on the NHS, and so on. I mean, is there anything parallel at all in Guernsey that you could refer to and say, well, look, if a few of your senior staff are off sick, then yes, you might have to wait a little bit longer. There might be waiting list issues. Or does that not really exist in Guernsey?
No, that we do have waiting list issues, not so much for outpatient care, but some surgical specialties. And that's because we've got a limit in the hospital of just 4 theatres at the moment. Now, we've just undergone the phase 1 of our hospital rebuild, which has got a new critical care unit. The second phase is to add 4 theatres, a new private wing. We've got a fantastic private wing in the hospital, but it needs a bit of an upgrade. We have 2 chefs that work just in the private wing who go round and often go down to the harbour and get fish in the harbour, and we'll offer that. And it's awful when I do my rounds 6 or 7 o'clock at night with my private patients eating beautiful food. And then I often moan when I get home that I'm not having the same sort of standard of food. Doesn't go down very well. But yes, we are a bit limited.
So sort of dry potatoes and sort of quite chewy pork chops doesn't necessarily exist.
Not quite as bad as that. But no, the food is amazing. But we do have hospital limitations, but there is a planned second and third phase hospital projects that will improve those. So it's not all perfect, certainly. Yeah. But again...
But they're looking to make improvements.
And again, actually, for people who do have to wait for their surgery, because they have the personal touch and they've got direct access to consultants, PAs, whilst it's never great to be waiting time for your surgery, I think it's less stressful than in the UK. One of the problems we do have is we do send some patients to the UK for very specialist treatment, and patients really don't understand that the wait's going to be that much longer, and also they're not going to be seeing a consultant even for specialist treatment when they go in there. And that's a real problem we have when patients come back. They're often dissatisfied because they think that they're going to receive the same
Guernsey service
as they do in Guernsey.
That's quite interesting as well. I think it's important to make people aware, isn't it, that if you require specific procedures or specific treatment, some of that is not done in Guernsey, and you might have to travel to, for example, Southampton?
Southampton's our link hospital, but we do have other link hospitals. But actually, we do offer far more for the size of the jurisdiction than a district general hospital serving 4 times the population would offer in the UK. And the reason for that is that people expect it, and people expect high standards of care in healthcare. But also, we tend to attract more experienced consultants who've worked elsewhere, who then come to Guernsey. And that's really important, because actually one of the good things that the NHS does is provide a support structure to their doctors, which in a small company, as we were, we can't often provide. So we do, we try to recruit sort of experienced and very good doctors to provide that care. But there are certain things that we can't offer. For instance, radiotherapy. We just don't have the population to justify the expense of radiotherapy, so that would go to Southampton. But we do sort of offer far more than a district general hospital 4 times the size would offer in the UK.
Okay. And in terms of another issue that is here, and it'd be interesting to get your perspective on what the take is in Guernsey really is. Obviously, we see about these strikes, people being balloted for strike, junior doctors you mentioned earlier. Is there any of that kind of disruption
None at all
in Guernsey, or any of that sort of tension?
None at all. And I had a family member that was very ill that required very specialist care at King's Hospital that was cancelled 3 times because of junior doctor strikes. Actually, even though we had private insurance, it had to be done in the private hospital. And that really, I'll sound like an old fuddy-duddy consultant who feels that doctors shouldn't strike at all, but you just wouldn't get that in Guernsey because of the different system.
Okay. And just to touch on before we get to a couple of questions, that private insurance aspect that you mentioned, you said a lot of people, maybe 30% do have that.
Yeah.
What does that look like? How much a month maybe are people potentially looking to pay for that sort of insurance program that maybe gives you a bit more flexibility, gives you more options?
Yeah, it really depends on your previous medical history and your age. So it varies. Private insurance for secondary care, I would proudly say, although not very business orientated, doesn't make a huge amount of difference in Guernsey because it's all consultant delivered, and I think the level of care is excellent. But it does give you a bit of flexibility. And actually, it's really important and useful if you do have to be referred back to the UK for specialist treatment we can't offer in Guernsey, because that does obviously quicken things up significantly.
Thank you very much indeed. I want to give people the opportunity to ask a question. It's great to have an expert with us to give us a sense of what the system is like in Guernsey. So if you do want to ask a question to Owen, we've got a hand up at the back there. Thank you, Asta. Hello there.
Hello, Nicola Cope from Bath. I happened to speak to your secretarial department before here. They told me that the main point in relocating to Jersey was, amongst other things, getting NHS records across. Might you like to comment? And secondly, what are the limitations in Guernsey if you have a medical emergency or need a thrombectomy or things like that?
Yes, so medical records is a bit of an issue, actually, and also communication. So it's interesting when we do have patients go to the UK hospitals who are discharged, because the UK hospitals, the discharge summary is usually done by junior doctors who write to GPs. They'll discharge letters to GPs, but not to us in secondary care. So we do have to chase that up. So that's an issue. Actually, access to NHS records isn't so difficult now. Everything's being digitalised. So that's not an issue. Medical emergencies, that's a really good question in the fact, and that's why we tend to appoint older doctors who, before they specialise, have a more generalised training, who can deal with most things. And that's why we provide a very high level of non-emergency care, because it keeps our skills up with emergency care. So, for instance, I cover all the emergency children's surgery. And we know that once in every 3 or 4 years, we'll have a child in who's really sick, and we're fogged in, we can't even get a coastal helicopter in, and we have to deal with it. But we've got the experience and support to deal with it, or at least keep someone alive until we can transfer someone off island. But certainly in the surgical specialties, it's very, very rare to have to transfer someone off island. So we're well catered for that because of the sort of doctor cohort we've got.
It's interesting you talk about that real experience you have on island with your colleagues. I'm sure that'd be reassuring for people. Do we have another question for Owen? Hello, lady at the front. Asta, thank you very much indeed.
Hello, Juliet from Princess Risborough. I just wanted to ask, everyone talks in the UK about sort of ageing population. What are the sort of provisions on Guernsey for that, thinking forward?
So we do have similar problems with social care and care home facilities, which can cause knockback in terms of hospital beds occupation. What we do have, though, as a product of the geography of the islands, is a really good community-based medical service, both doctor and nursing, which keeps people out of hospital, and also provides, care at home is far better than care in hospital. So I think our elderly population get very well catered for in the fact that they're well supported at home. Whilst I'm the only urologist, I'm involved in a big sort of community urology team. So we know exactly what's going on in the home of patients that need urological input, and that essentially keeps them out of hospital as much as possible. So I think people living at home, elderly people living at home, are really well supported by a very good community service, which of course is helped by the geography of the islands, but nevertheless is really important.
Owen, thank you very much indeed. Another good question. Thank you. Do we have one more before we break for lunch? Thank you. We're going to just give this lady at the front the chance. But as I've said through the morning here, we will have the chance to chat to our guests, ask the questions. Owen, you'll be sticking around, won't you? He's there to answer your questions. Hello there.
Hiya. What provisions or what sort of consequences are there for somebody moving over with an existing long-term medical condition?
Of course, it depends on the condition, but generally, so we cover all specialties through our partnership. So, we have consultants in all specialties. There are a few specialties where, because of patient volume, we don't appoint specialists, but we have visiting consultants come over. So all specialties are covered, be it through the partnership or through visiting consultants. So it's rare for someone, even to have a very rare condition that can't be managed on islands unless something very nuanced or specific is needed. So I think it's, most conditions, 99% of conditions are covered for sure.
And would that be through the secondary care, or would it be on a private?
No. So pre-existing conditions are all free at the secondary care is free at the point of delivery. So that's not an issue at all for pre-existing conditions, as it might be if you're taking out private medical insurance, of course. So no, that's not an issue whatsoever.
Okay, thank you.
Thank you very much, and some really interesting questions and answers. I feel like I'm maybe on a session of This Morning here with our consultant doctor, getting all your questions away. It's been really interesting to listen in.